video, I am going to show you how you can put together a quote for the patient from the restorative charting screen. So in your restorative charting, we are first going to make sure that in our view options on this lower left-hand side, this bottom option here, add procedures as accepted, is turned off. So because we're putting together a quote for the patient, we want the procedures to be added as a proposed only. If this is ticked, they're going to be added as accepted, and it sort of makes the quote null and void because they're instantly going to show up in the patient treatment plan. So to put together a quote, we're going to have this option turned off. The next thing we're going to do is on this lower chart here, we select the option Create New Quote. We can give it a name, that is optional, you don't have to do that. And we'll make sure that the correct provider is selected. And okay. So now we have got a field in which we can add in all of those recommended item numbers. I am going to start with a debridement. This is a perio patient, so we need to do some really thorough cleaning. I will use my customized option down here for debridement, and I've touched on in a previous video how you can create these custom options, and I'll pop that in place. So instantly we've got all of those required item codes in there. Next, I'm going to say, right, 1.7, maybe 1.5, let's do some anterior fillings. All of these surfaces will require some fillings, and they're just going to be composites, and I'll put them in. I can go through and repeat this process with as many item codes as I need to put together an accurate quote for this patient. From here, I'm pretty happy with how this looks for now. There is an accept button here. To be honest, from this screen, I'd probably leave that. It's null and void now because we do have the option to just add things in as accepted straight away. So instead, I would save this and close, and I'd go to my quotes area instead. We will see, here is this quote that we've just put together. All of the screens within Praktika do talk to one another. So we've got this quote with our debridement and some fillings in place. You will have the option to connect with your HiCaps machine or your Tyro machine. Either option will work for you. You can do this to actually process a quote through the patient's private health insurance. So click on the option that you have at your practice and follow the prompt through to swipe that patient card on the terminal. This is going to return a document similar to this one here that I've got up on the screen. So it's going to have your practice details and your logo up the top. It's a very official looking PDF document. Rather than just printing off that little receipt that comes out of the terminal, which the patients always lose, you can save this in the patient file, or you can email a copy to them. We make it very clear that this estimate is only valid at the time of processing. Lots of different factors can come into play, whether or not they've used up all of their benefits elsewhere, they change their insurance level. There's lots of things that can affect it. But essentially we're going to list all of those item codes that you've got in the quote, and there will be a column to show the benefit and the gap. So the patient is really going to understand how much of this quote they are likely to have to pay. You can email a copy of that through for the patient or just save a copy in their file. You can also email this directly to them. So if they don't have private health insurance, you just want to email a quote through for them, you have an option down here. You're going to click on this PDF button and you can print a copy, download a copy. I am going to email a PDF through for them. If you have a nice template available, like this one here, we can just create a document. And you'll see, Dear June, thanks for visiting, and here is a copy of the quote attached. All I'd have to do is email and it's done. From here, if we're happy this patient is going to come in and have this treatment done, we can mark this as accepted. and then it's going to show up in their treatment plan. If we're not sure what the patient's intentions are, we can just leave it for now. It's not going to do any harm sitting in this quotes area. We can leave some notes down here if need be, or create yourself a clinical note, to discuss what's been mentioned with the patient. But essentially, the goal from here is to mark this as accepted, which I'll do now, because then it will show up in that patient treatment plan. From here, same as the previous video, we can list it into different visits. If you've forgotten anything, you can add them in by either clicking on this plus button to find a one-off item number, or clicking on add preset to add in different things. So if you have missed anything, you do not have to go back and repeat the steps. You can do it all from this screen. I hope this helps.